Taylor Andre here to do head to toe assessment. First, going to start by washing my hands. And now I'm going to enter the patient's room. How you doing today, sir?
Good, how are you?
Good. My name is Taylor Andre. I'm a nurse practitioner student at South University. I'll be doing your wellness exam today.
Okay.
Can you tell me your name?
Kyle Andre,
Do you know where you're at?
Claxton Clinic,
Do you know what time of the day it is?
around 8 o'clock.
Do you know who the president is?
Donald Trump.
Alright. So the patient's alert and orient times 3. He answers questions appropriately. He's well groomed, well dressed, appropriate for the season. He's in no acute distress at this time. Respirations are even and unlabored. Prior to coming into the room, the nurse took his vitals. His temp was 98.3, heart rate 63, blood pressure 120/73, respirations 12. O2 sat was 100% on room air. His height is 75 inches, weight is 200 pounds, and his BMI is 25, which is normal. He is not overweight or obese, and he's perfect. His skin is warm, dry, intact. It is moist. He does not look dehydrated. I do not see any lesions, any abrasions, no cuts, no bruises. I'm just going to look at his head now. I'm examining his scalp. His hair is evenly distributed. I don't see any lesions in his scalp, any tenderness here.
Nope.
Patient has no tenderness in his head, so that is normal. Looking at his face is symmetrical. I don't see any swelling to one side, no facial drooping, nothing like that. I'm going to palpate his temporal pulses, and they are 2+ bilaterally and symmetrical. Don't feel any kind of deformities there. Can you clench your jaw for me? I'm just going to palpate here for the TMJ. Can you open your mouth, close? Did not feel any clicks there. Did you have any tenderness? Nope. Patient's negative for TMJ and cranial nerve 5. The trigeminal nerve is intact. All right, now I'm going to do some facial cranial nerve testing. If you can smile for me, raise your eyebrows, puff your cheeks. Okay, good. I'm going to do some sharp and soft objects. So close your eyes for me, and I'm going to touch you with a soft object, sharp object. You tell me which.
Sharp, sorry. Soft, sharp, soft, sharp, soft.
Okay. Patient did do fine with that. A cranial nerve 7 is intact, the facial nerve. All right, now I'm going to just examine his eyes. Prior to coming into the room, the nurse tested him with the Snellen chart. His vision was a 20 out of 20. So he has perfect vision. He can see 20 feet of what a normal person could see at 20 feet. He wears no contacts or glasses. I'm going to test the peripheral vision now. So if you would close your, put your hand over your right eye, and I'm going to hold up a number. You tell me what number I'm holding up.
2, 1, 2, 1.
Okay, other eye.
2, 1, 2, 1.
Okay. Patient has perfect peripheral vision, so no kind of deformities there. Now I'm going to test extraocular movements. This is testing cranial nerves 3, 4, and 6. If you could just follow my pen light. Okay. And the patient did follow my pen light well. I didn't see any nystagmus, no abnormal eye movements. So that was perfect. I'm just going to look at his pupils now, and I'm examining his cornea and his iris at this time. Everything is round. The cornea is clear. The iris is clear. The pupils are about 4 millimeters right now. He is staring at me with a complete gaze, so he has no kind of abnormal eye movements. His conjunctiva is pink and warm, and pink and intact. His sclera is white. I do not see any jaundice or anything like that. So now I'm just going to test your pupil reaction to light. If you would look at the wall for me. Okay. His pupils did constrict to light. So that was cranial nerves 2 and 3 intact. I'm going to test for accommodation now. If you would just stare at my finger, I'm going to come towards your nose. Okay. And the patient's eyes did accommodate. The pupils did constrict when my finger got close to his nose, and that was cranial nerve 3, the oculomotor nerve intact. I'm gonna look in his eyes now with my ophthalmoscope. Look at his internal eye structures. Look at the wall for me, please. Okay. Okay. The patient's, I did note the red reflex on the ophthalmoscope exam. His optic disc was orange and round, which is normal, and his internal eye vessels were all intact. I didn't see any kind of hemorrhaging in the eye. So now I'm just going to inspect the ears. The ears are symmetrical. They are round. I do not see any kind of lesions, no abnormalities of the ears, any tenderness here.
Nope.
Okay, and no abnormal moles or anything like that. Now I'm going to do a whisper hearing test. So if you could just repeat after me what you hear in your ear, okay?
1, 2, 3. ABC.
That was normal, and cranial nerve 8 was intact. That was the acoustic nerve. Now I'm going to do some sounds with testing sound with the tuning fork. If you would, this is the Weber test. I'm going to place this on your forehead. It's going to make a sound, and you tell me if you hear it best the right, left, or the middle.
Okay. Middle.
Okay, so that is normal. The patient can hear bilaterally, evenly, and well. Now I'm going to do the Rene test. This is going to test air and bone conduction. The patient should hear air conduction better than bone conduction. So this will be position A, and this will be position B. You tell me where you hear the sound the loudest at.
Okay.
Okay, so the patient did hear air conduction better than bone conduction, which is normal. Now I'm going to look in his ears with the ophthalmoscope. Just look straight at that wall for me. Alright. So the internal ear did look normal. The internal ear canal was pink. I didn't see any kind of swelling or arrhythmia. The tympanic membranes were pearly gray. Didn't see any exudate in there. No swelling, no perforation. The landmarks were easily visualized. I saw the light reflex at the 5 o'clock position in the right ear and the 7 o'clock position in the left ear. Now we're going to move on to his nose. I'm going to just looking at his nose, it looks symmetrical. Don't see any deformities. I'm just going to test your patency of your nose. So include one nostril. Can you breathe well
Yep.
out of that nostril? Other one?
Yep.
Okay. All right, so the nares are patent. I'm going to look in your nose with the otoscope. Just examining the terminal nares. The turbinates look fine. They do not look swollen. I didn't see any polyps. The mucosa was pink and moist. Didn't see any bogginess or paleness, nothing like that. All right, and tell me if you have any tenderness right here.
Nope.
And this is the frontal and maxillary sinuses. Patient did not have any tenderness, so probably no infection in there. All right, now I'm just going to look at, let me get my gloves. I'm gonna look in your mouth. Okay. So say ah for me. And I do see the tonsils. The back of the pharynx is not red. I don't see any arrhythmia. No exudates. The tonsils are 1+, so they're normal. And the lips, they look moist. I don't see any dryness, no scaling. The teeth, I didn't see any decay, no kind of abscess, nothing like that. The gums were pink and moist. I didn't see any lesions. Nothing on the oral mucosa to signal any abnormalities. Now I'm just going to assess your swallowing. So swallow this water for me, and I'm going to watch how the uvula, it does rise and fall normal. And stick out your tongue for me and say ah. One more time. Okay. The uvula does rise and fall, so that's cranial nerves 9 and 10 intact. Stick out your tongue for me. The patient's face is symmetrical. I don't see any facial drooping. So that's cranial nerve 12 intact. Now we're going to move on to your neck. We're going to do some range of motion. So can you bend this way, flex, and extend, and rotate, and rotate? Okay, normal range of motion in the neck. I'm going to name off some lymph nodes of your face and your neck, okay? Preauricular, postauricular, tonsillar, submandibular, submental, superficial cervical, posterior cervical, supraclavicular. And I did not feel any palpable lymph nodes, so that is normal. Patient probably does not have any infection of the face or the neck. Now I'm going to look at your thyroid gland. It does not look swollen. Any tenderness?
Nope.
Doesn't feel swollen. Okay, swallow for me. Okay, and that is normal. The thyroid was not enlarged. I did not feel any nodules. Now I'm going to look at your shoulders and your upper extremities. Palpating for some lymph nodes here. I do not feel any swollen lymph nodes. Any tenderness?
Nope.
Okay. All right, can you remove your shirt for me?
Yes.
Okay. All right. Any tenderness in here?
Nope.
What about the midline?
Nope.
All right, let's do some range of motion with your shoulders. So can you flex and extend and abduct, adduct, and rotate? And what about this way? Okay, the patient has normal range of motion in the shoulders. Can you shrug against my resistance? Okay, patient was able to do that normal. That's cranial nerve 11 intact. I'm just going to look at his elbows now. And they do not look abnormal. Any tenderness here?
Nope.
Okay. No tenderness, no deformities, nothing like that. Can you flex your elbows for me? Extend. Okay. Pronation, supination, and the patient has normal range of motion in his elbows. I'm going to look at the radial pulses now. And they are 2+ and equal bilaterally. And the brachials are the same, 2+ equal bilaterally. Don't feel any kind of skips in his pulse. Let's do some upper extremity strength. Push against my resistance, and down, out, and in. Upper extremity strength is a 5 out of 5, and that is normal. Now I'm going to look at his chest and his neck. Chest is symmetrical. The movement of the chest, it falls and rises easily. I don't see any deviation in the chest. The AP to lateral diameter is 1:2 ratio, which is normal. And now I'm going to look at your neck. Let me grab my stethoscope. All right, so I'm going to auscultate your carotids. With the veil. Didn't hear any bruise in there, so that is normal. I'm going to palpate the carotids. They are very strong, 2+ bilaterally, which is normal. Don't feel any deformities in the carotids. Now I'm just going to auscultate the heart. This is aortic, pulmonic, Erb's point, tricuspid, and the mitral. And the heart rate was even and regular. If I wanted to palpate the point of maximal impulse, it would be to the left of the chest, right under the left breast. And I could actually count his heart rate here, but we've already counted it with 63, so I'm not going to do that right now. I'm going to assess the interior lung sounds. If you will, just take a deep breath for me when I touch you. Lungs were clear bilaterally, didn't hear any kind of diminished lung sounds, no crackles, bronchi rails, nothing like that. I'm going to move on to the posterior chest now. I'm going to touch you, and when I do, you say 99.
99, 99, 99, 99.
Okay, so that was normal tactile fremitus. If the vibrations were to be very harsh, that would maybe say be that the patient has some consolidation in his lungs. But I didn't feel any extra vibration sounds with that. I'm just going to percuss the back of the chest now. And that was normal. I didn't hear any kind of abnormal percussion sounds that may signify that he has air fluid space in his lungs. Let me listen for egophony and bronchophony. When I touch you, say E, E, E.
E, 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 E.
Okay. The patient, I did hear E, E, E. If I would have heard A, 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 it could mean that the patient is positive for egophony, meaning that he might have some consolidation in his lungs. Now I'm going to test for bronchophony. Say 99 when I touch you.
99, 99, 99, 99, 99, 99.
Okay. That was normal. I heard a muffled 99. If 99 were heard clearly in the chest on auscultation, it may mean that the patient does have bronchophony, which means there may be consolidation in the lungs. We're going to move on to the abdomen now. So if you will, just lay back for me. Okay. All right, just looking at the abdomen, it is not distended. It is flat. I don't see any hernias. I don't see any kind of striae or scars. He has not had any surgery. I don't see any masses. So first I'm just going to listen to the vowel sounds in all four quadrants. Okay. And I did hear vowel sounds present in all four quadrants. I'm going to auscultate some vascular sounds. This is abdominal aorta and the renal arteries, iliac arteries, and the femoral arteries. And I did not hear any kind of bruise in there, so that is normal. Now I'm going to percuss in all four quadrants. And that I heard tympany, so that's normal. I'm going to percuss the liver now. And this is a dullness, which is normal to the liver. And the liver is normal in size. Didn't feel any kind of enlargement, or didn't hear any enlargement. I'm going to percuss the spleen just to make sure it's not enlarged. And it is not. It is normal in size. Now I'm going to palpate the abdominal aorta and note the width. And it's about 2 centimeters, which is normal. And I do not see any pulsation there, which would mean maybe an abdominal mass. And now I'm just going to do some palpation, light first. Any tenderness?
Nope.
Okay, this is some deep palpation. Any tenderness? No. Okay. If the patient did have a rebound tenderness response, when you press in the right lower quadrant, if you press down on deep palpation, and when you lift up your hands and release the pressure, the patient would have a severe pain response, which may mean he could have an appendicitis. Now I'm going to assess the Sayos and the obturator sign. So lift your leg down for me. Just lift your leg up against my hand resistance. Spin. Any pain?
No.
If the patient did have a positive Sayos sign, he would have pain in the right lower quadrant, possibly being an appendicitis. This is the obturator. Any pain there?
No, ma'am.
All right. The patient has no pain, so probably no kind of appendix problem. All right, you can sit up for me. I'm sorry, let me look at your bladder real quick. Lay back down real quick.
Okay.
All right. So I'm just going to palpate the bladder. Don't hear any kind of extra fluid in the bladder or anything like that. Any tenderness?
Nope.
The bladder is non-distended. No abnormalities there. I'm going to check for CVA tenderness. Tell me if you have pain when I do this, okay?
Nope. Nope.
Okay, no CVA tenderness. If the patient were to have CVA tenderness, it could mean that he could have a possible kidney infection, UCI, kidney stone, something wrong with his bladder and kidneys. All right, I'm gonna look at your lower extremities, inspect for edema. I do not see any kind of edema, no swelling, no kind of change in color in the lower extremities, no ecchymosis, nothing like that. Looking at the hips, they look symmetrical. I do not see any deformities, no swelling, any tenderness here.
Nope.
Okay, let's do some hip range of motion. Lay back down for me real quick. Okay. All right, so leg up. Anything there? Up. That's flexion and extension is normal there. We're going to go out. Let's straighten your leg.
Sorry.
Okay, that's abduction and abduction. Out. All right, good range of motion there. And we're just going to rotate. In.
Nope.
Okay, and this way.
Okay.
Okay, so patient has no range of motion in the hips. All right, sit up for me. We're going to look at your knees. Can you flex your knees for me? And I don't see any swelling in the knees. I don't feel any crepitus. The knees look symmetrical. No deformities there. Let's do internal rotation of the knees. And he has no kind of limitations there. And let's do the interior drawer maneuver. So lay back down for me.
Okay.
Put your leg up, heel in the bed. I would sit on the patient's foot and I would draw the tibia forward. And I do not feel the tibia moving. So that would be a negative interior draw maneuver. And the same with this knee. So he has no kind of problems with his ACL in his knee. All right, we're gonna do some pulses here. This is the pedal pulse, and this is the posterior tibial pulse. The popliteal, and the femoral would be in the groin. I'm not going to touch him there, but all the pulses were 2+ equal bilaterally. Didn't feel any kind of skips in the pulses there. Let's do some sensations in your lower extremities. Close your eyes for me. Tell me when you feel a sharp or soft object.
Soft, sharp, soft, sharp, soft, sharp, soft, sharp.
Okay. And the patient passed that with flying colors, so no kind of abnormalities there. Can you push in for me with your legs? Push out, push forward, push back. The patient has 5 out of 5 strength in his lower extremities, which is normal. Let's see. Let's do some neurological testing. So stand up for me. Actually, let's do deep tendon reflexes first. Okay. This is the patellar, the Achilles, the biceps. I'm sorry. The brachioradialis and the triceps. Okay. Patient has a 3+ deep tendon reflexes, so that is normal. Let's do a plantar response on the bottom of your foot. This may tickle a little bit.
Yep.
Okay. Okay, and the patient's toes do curl inward, which is a normal plantar response of the feet. All right, let's see if you can identify some objects for me. So close your eyes. I'm going to place an object in your hand, and you tell me what it is.
It's a key.
Okay. And
It's a pen.
okay. All right, so the patient can identify objects fine. So let's do some coordination of the upper extremities. Follow me. Patient is coordinated in upper extremities. Let's do some lower extremity coordination. Just tap your toes. Okay. Patient is coordinated in his feet. Now we're going to do some gait walking. So heel to toe and just walk a straight line for me. Okay. Patient has a normal gait. Now we're going to do some range of motion of the spine. So bend this way or turn this way. This is rotation. Go forward, flexion and back extension, side to side, and this is lateral bending. Patient has normal range of motion in his spine. Now we're going to do the pronator drift. So if you would close your eyes and hold out your hands with palms up, and just hold them there for a minute. And the patient does not have a pronator drift, so that's normal. And now we're going to just close your eyes again. I'm going to test your balance, okay?
Mhm.
All right. Patient has normal balance. So I think that concludes our assessment, head to toe assessment and wellness exam. Thank you so much.
Thank you.
All right, have a good day.